In this video today with Medicare with Melissa, we're going to talk about the infamous donut hole. What is it, and how does it impact the price that you pay for your medications? My name is Melissa McCalla, owner and agent of Senior Healthcare Solutions. Our family and team have been assisting Medicare beneficiaries since 2014. Medicare is our passion, and we enjoy helping people choose the right plan that suits their needs when they are enrolling in a Medicare plan. Sometimes you just can't avoid it, and you may hit the donut hole depending on your medications. In today's video, we explain Medicare Part D costs, the 4 phases of Medicare Part D, including the donut hole. If you've seen some of our other fun videos, then be sure to have something to write with because we've got some key takeaways for you. Some fun facts about Medicare Part D. Medicare drug coverage was introduced in 2006 to help reduce out-of-pocket costs with medications. You are not required to be enrolled in a Part D plan, but you could be penalized if you don't have credible insurance. You can obtain Part D coverage 2 ways: enrolling in a Medicare Advantage plan that includes drug coverage, or enrolling in a standalone drug plan, typically done when you have a Medicare supplemental plan. Medicare drug plans categorize costs by tier. The higher the tier of the drug, the higher the cost. There are discount programs available that could help you save even more money. Part D coverage is designed to help lower costs for self-administered prescriptions only. Infusion drugs or treatment drugs that you receive at your physician's offices or a hospital are covered underneath your Part B. There are 4 phases or levels to all Medicare Part D plans: deductible, initial, coverage gap, also known as the donut hole, and catastrophic. To simply put it, the various coverage phases and levels will impact what you, as the consumer, will pay for your medications. Not all Medicare drug plans have deductibles. If your plan has a deductible, it's likely that you will not pay your deductible or meet it if your prescription is a Tier 1 or Tier 2 drug. Depending on the prescriptions you take, or if any, you may not have ever known that there are different coverage levels to Part D plans. That's because other than the plan you choose, the medications you take, dosage, frequency, and pharmacy all impact your cost, which I'm going to talk about more next. The 2022 standard deductible is $480, although that can vary depending on your prescription drug plan. Initial coverage level. Once the deductible has been satisfied, you will fall into your initial coverage level. You will pay a copay during this time, and the insurance company pays the remaining balance. Donut hole. You fall into the donut hole when you and the insurance company have spent $4,430. That's this year in 2022. During this coverage level, you can expect to pay 25% the cost of your medication. Your costs are generally highest during this phase. Catastrophic. You fall into the catastrophic phase when you and the insurance company have spent $7,050, again this year in 2022. During this coverage level, you can expect to pay 5% or $395 for a generic and $985 for a brand name prescription. Your cost is generally lowest during this phase. Costs can vary from plan to plan based on formulary coverage. Costs will also vary from generic to brand medications and preferred pharmacy to non-preferred or standard pharmacy pricing. Are you ready to secure your enrollment in a Medicare Part D plan? There are certain enrollment periods to change or enroll into a Medicare Part D plan. The easiest thing you can do is call one of our team members to check your eligibility. Schedule an appointment or call now. We will help compare coverage options and make sure your application makes it to the carrier securely. We will be your liaison from start to finish and look forward to assisting you with all of your Medicare needs now and in the future. All right, now it's time for you to get your pen and paper out for our key takeaways regarding Part D plans with Medicare. Part D coverage can be obtained by enrolling in a Medicare Advantage plan that includes drug coverage, or enrolling in a standalone plan, commonly done in combination with a Medicare supplement plan. Part D coverage is optional, but you could be penalized if you decide to enroll after your initial eligibility. There are 4 phases of drug coverage that will impact what you pay at the pharmacy. The pharmacy you choose can impact what you pay for your prescription. Your drug costs are generally highest if you are in your donut hole. All drug plans have a donut hole coverage level. It simply depends on the medications you take and how the carrier categorizes the tier of the medication. Medicare drug plans categorize cost by tier. The higher the tier of the drug, the higher the cost of the medication. To compare, change, or enroll plans, schedule an appointment or give us a call today. In the video description below, there is a link to the infographic that we used in today's video to help compare the Part D cost. If you like this video, you should check out our other videos such as Medicare Supplement versus Medicare Advantage. As always, if you like today's video, make sure to give it a 2 thumbs up and tell your friends and family about us so we can assist them in choosing the right plan as well. Thanks again for watching Medicare with Melissa, and I'll see you soon.